Meet John, an 11-year-old boy. He's been missing school because of stomach pain, fatigue, and frequent trips to the bathroom. His parents know something's wrong, but they don't yet have answers. In Canada, more and more children like John are being diagnosed with inflammatory bowel disease, one of the highest rates in the world. IBD is a chronic condition where the immune system mistakenly attacks the gut, causing ongoing inflammation and damage. Although it's caused by many things, in children, this disease is most often driven by immune dysfunction, making it critical that we understand what the immune system is doing. But right now, we don't measure immune activity directly. Instead, John will come in for blood tests and stool tests, markers like CRP and fecal calprotectin that only give us indirect clues. Sometimes they're elevated, sometimes they're normal, even when disease is active. And when doctors need a real answer, John will need a colonoscopy, a more invasive procedure requiring sedation. In a Canadian healthcare system already facing long wait times, this uncertainty can mean more testing, more procedures, and more waiting for both answers and treatment. So my research asks us a different question. What if we can measure John's immune system directly in real time? Using a technique called phosphoflow cytometry, we take a blood sample, stimulate immune cells, send them through a tube with light, and measure on the spot how key inflammatory pathways respond. Specifically, we take a look at the JAK-STAT pathway, a central driver of inflammation in IBD. In this study, we will analyze samples from about 100 pediatric patients, measuring activations of proteins like STAT1 and 3, and compare those responses to current biomarkers like CRP and fecal calprotectin. The key question is simple. Do these real-time immune signals reflect disease activity? And if they don't match current tests, are we uncovering something more accurate? If this works, patients like John wouldn't have to wait days for results or rely as heavily on invasive procedures. We could move toward same-day answers, earlier treatment decisions, and more precise, targeted care, especially for children. John doesn't just need a diagnosis. He needs timely, accurate insight into what his disease is doing in the moment. Right now, we measure the consequences of inflammation, often after the damage has already begun. This research moves us towards measuring the immune system itself in real time as it's happening, from cells to symptoms. Hopefully, we can translate this knowledge into better care for children like John and reassurance for their families. And in time, hopefully we can extend this approach to hundreds of other immune-driven diseases. This is where that journey begins, towards diagnosing earlier, understanding deeper, and treating our patients better.